Well, thank you, everybody. Thank you for having me today, and I'm so excited to have such a great turnout. I want to follow up on something that Sharon mentioned. As Sharon said, she's part of our arts and medicine team. Our department, psychosocial resource and spiritual resources, is over at Westmount Shopping Center. That's where all of our programs take place. And there we have psychologists who meet with folks one-on-one or meet with certainly caregivers and family members. We have social workers, a spiritual care provider, lots of different support groups, specific survivorship support group that looks at, gives lots of opportunity for sharing and meeting other folks and talking about very similar issues to what we're talking about today. And the arts and medicine program that Sharon's a part of. So there's lots of different artists that come in from the community, and whether it's sculpting or watercolors or yoga or metal work, all kinds of neat stuff that happens. So you're all more than welcome to come. All of our services in the arts and medicine are free of charge. Free parking, that's big. We're proud of our free parking. But today I want to talk a little bit about fear and uncertainty, because certainly that's a very common experiences and emotions that people can experience with a cancer diagnosis, whether it's you as a patient or a family member. And doing this in the context of survivorship, I think, is important, because just like survivorship, it's a difficult word sometimes for people to kind of get a handle on, and there's no right way of being a survivor. There's lots of different ways of living with and after cancer. And it's really important for you to allow yourself to find the things that work for you. So what works for you might not work for your friend or colleague who had cancer. Often you hear, oh, you need to read this book, you need to do this, you need to feel this, you need to think that. And sometimes not all of those things work for everybody. So just like today, there may be lots of things that you get that really kind of resonate with you, and things that don't resonate so much, and that's okay too. Just allow yourself to be like a sieve and just sort of collect the things that fit. So, I don't know if any of you know the story of the Sword of Damocles. Damocles, Dionysus was a tyrant in 4th century BC in southern Italy. And as tyrants go, he was wealthy. He had sycophants in his court, people who sort of trailed him and told him how wonderful he was and how beautiful and how rich and wealthy and fabulous. And Damocles was one of these sort of ingratiators of his court, that he followed him around and told him all these lovely things and watched Dionysus at his feast at the table, and he had dancers and all kinds of quite a life. So one day after Dionysus had heard Damocles again say how wonderful his life was, said, "Do you want to trade spots for a day?" And Damocles thought that was a fabulous idea. Who wouldn't want to trade spots and live this kind of really exaggerated, sort of luxurious life? So Dionysus set it up so that he would have the same kind of day and experience as he normally would. And so he sat at the head of the table, and he had this lovely feast in front of him, and gestures and dancers and food and wine and all the merriment that comes with that. And as he was sort of surveying everything in front of him, he looked up and noticed that there was a sword dangling in front of his head. And it was just hanging by this one really, really thin horsehair. And it occurred to him, how can I enjoy all of this when I've got this sword hanging over my head? And often that's a story that sometimes can resonate with a lot of people who've gone through something traumatic and are told, you're so lucky you survived this, and just enjoy your life or enjoy the moments. And sometimes that's often easier said than done. And for some people, it can feel as though there's a sword hanging over, and trying to sort of try to learn how to live a life within sometimes what feels like a precarious situation. Certainly for many people, feeling fear and uncertainty goes hand in hand with a cancer experience. Feeling fear is a normal part of the human condition. As people, we feel all kinds of emotions, and from a course of a day can have lots of ups and downs. We can feel happy one minute, we can feel a little discouraged the next hour, we can feel hopeful, we can feel sadness, we can feel anxious, all kinds of things. So I think it's really important to remember, before a cancer experience entered your life, that life was about this sort of up and down, and there was natural ebbs and flows of emotions that would come and go. And with a cancer experience, that's certainly not going to change, and in fact, for many, it can intensify. So the highs feel a bit higher, the lows can feel somewhat lower, which is important to allow yourself just to feel those feelings and have those emotions. There's this idea sometimes that people have to be positive all the time and have to, and aren't supposed to feel afraid, or aren't supposed to feel sad, or aren't supposed to feel anxious. And I think that's pretty superhuman, maybe, to borrow, supermanish, to borrow a phrase from earlier, that it's pretty unrealistic to expect that of oneself, not to have a whole range of emotions that can come with a cancer experience. Just the fact of being alive and being a human being means that we have all kinds of emotions. And sometimes there can be a lot of expectations to be positive, which I think then can add on an extra layer of guilt. You feel badly for feeling badly, and it just kind of makes this whole trigger of emotion happen. So trying to just allow yourself to feel what you feel and not judge yourself for what you feel. That's different sometimes than maybe if you're feeling depressed all of the time. That's not a very helpful or hopeful or feel-good kind of thing, but certainly having a range of emotions is normal and expected, and human to do that. So often we can feel afraid when we feel a loss of safety, when our lives feel threatened in some way. We have this basic instinct for survival. And if we think about the fight or flight response, this goes back millions of years. So like right now, I'm feeling a little nervous, feeling a little afraid, not too threatened, but by my own thoughts maybe. But when you think about that fight or flight response and that automatic reaction that happens, for some people your hands get a little sweaty, your heart starts to beat a little bit, your stomach might get a little bit upset, your muscles get tense because you're getting ready to sort of fight some saber-toothed tiger or to get the heck out of there. So that happened certainly millions of years ago, and we needed that instinct to preserve life. Now we still have that instinct, but we'd have fewer saber-toothed tigers in our doorways every day, but we still have threats. So sometimes you feel that if you get cut off in traffic, or you're almost have like a near accident, and you can feel your sort of heart racing and your body getting a bit tense and tight and your breathing maybe changing. But we also can experience this with things we imagine in our minds too. So sometimes if we get into some of those what-if scenarios that can happen, what if my treatment didn't work? What if this feeling in my hip is really a bad sign that something's come back? What will happen 2 years from now? It can start that fight or flight kind of response too, and can start that kind of anxiety. So it's important to recognize that sometimes our own thoughts can really sort of encourage this anxiety too. So it doesn't have to be a real threat in front of us. It can also be, the things that we imagine. And sometimes they can really, those imagined fears can provoke that real strong sense of fear. So certainly feeling fear is a really normal experience. It's part of our repertoire of emotions. And it certainly comes with a cancer experience. And certainly the uncertainty, the unknown, creates a pretty large space to feel some of this fear. When we want things to make sense, and if things don't make sense, we're pretty good at trying to fill in the blanks to why things could be. We don't like those unanswered questions or those loose ends. So sometimes we use this head of ours to fill in the blanks and try to make sense of something that maybe doesn't make sense and won't make sense. And sometimes what we use to fill in the blanks can really, again, kind of create that sense of fear and anxiety, because we're usually pretty good with our imaginations and imagining the worst case scenario. So often we're filling in the blanks with usually not helpful thoughts or realistic thoughts, but they can get pretty unrealistic and pretty fear-based pretty quickly. There's certainly nothing afraid with feeling fear from time to time. That's, again, a normal part of being alive, is feeling afraid from time to time. But sometimes getting stuck in that fear where it prevents you from doing things that you enjoy, or prevents you from connecting to other people, or keeps you sort of feeling a little bit isolated, is probably not a helpful thing. And that's why there's lots of people, too, that can help and maybe provide some suggestions and some support. And sometimes it can just get really discouraging if you're in this space of feeling anxious and afraid or uncertain all the time, because you can think, well, why have I gone through all of this treatment only to feel so afraid and to feel so disconnected from everybody in my life? So that's always a bit of a challenge, too. So this picture is of a beach that I was on a few months ago. And when I was there, there were some really nice waves, and I was sort of standing in the water and challenging myself to sort of face the wave straight on and not let it knock me over. So the wave would come, I'd sort of get into position, and time after time, I would sort of go under the water, kind of reorient myself, pop up, gasping, trying to collect myself, and start again, turn around, catch my breath, try to sort of stay still and centered and try to stand erect during this wave. And again, I'd keep kind of getting pulled under and not being very successful. So then I decided to change strategies and do something different and turn around. And as the wave would come, I thought, I'm just kind of going to go with the wave and see where it leads. So certainly that was a much more gentle ride. The wave would come, I'd sort of lean into it and let it carry me to the shore. And it was sort of a nice, gentle experience, and I would kind of come through that without feeling so breathless and disoriented. No sputtering. And I think our emotions are often like that. We can imagine them like a wave and the ebb and flow of a wave. And certainly fighting against a wave, just like fighting against emotion, we might feel a bit overwhelmed, and we might kind of feel like we're going to succumb to these emotions a little bit and feel a little breathless from time to time. So fighting an emotion by saying, I'm not supposed to feel this way, I can't cry, I'm not supposed to feel nervous, I'm not supposed to feel afraid, I'm not supposed to feel upset. Not allowing ourselves to feel those emotions can be a really terrible experience that can sometimes amplify them and make things last a little longer and make us maybe a little more likely to sort of lose our breath and our perspective with all of that. But riding a wave and riding an emotion, we tend to realize then that, like waves, emotions don't last. They come and go. And we ride that wave of maybe sadness or that wave of fear, and we'll come to the other side of it before we start again. But they always are changing, and they come and they go. And I think sometimes we get so afraid of feeling something and try to fight against that because we're afraid it will pull us under. But just sort of riding the wave of that emotion and waiting for it to pass over and waiting for it to sort of deliver us to the shore where we can sort of collect ourselves. So what are some common fears that many people can experience? Certainly that fear of recurrence tends to be the number one fear that patients say that they experience after a cancer diagnosis. Even for people who have gone through an experience and are told you have like a 99.999% chance of never having cancer again, just that wiggle room of 0.01% chance can really create a lot of nervousness and fear. Fear of death, fear of the unknown. What will that be like? What will that experience be like? Will there be suffering? Again, that head can kind of get away from us sometimes. Fear of never feeling good again. Will I ever be able to go back and do this? Will I be able to go back to work? Will I ever feel normal? Will I ever be able to do those things that I did before? and the losses that sometimes come with a cancer experience. So a fear of losing maybe a job or losing relationships, or a fear of losing certain roles that we have in families and with friendships. And again, that fear of the unknown and the what ifs can create lots of challenging feelings. So how can we strengthen the horsehair or loosen that fear and anxiety? So when you think about that horsehair of Damocles' sword, how can we kind of maybe weave a few more threads in there to make it feel a little bit stronger? So sometimes just interrupting the fear, because it can be such an intense feeling and it can be so consuming, whether your body's feeling tight or whether your mind is really working overtime, and really trying to do some things that just help break that up a little bit can be helpful. So trying to create some space between that fear or that thought and something else. Sometimes just taking a pause, physically getting up and maybe moving out of the room can help loosen those thoughts a little bit. Make some tea, call a friend, work on a puzzle, get outside. Sometimes leaving that room and leaving that space can help loosen that fear. Asking for help, asking for some support can be a big benefit. Sometimes talking with people who are willing to listen, who are able to listen. Sometimes those fears have a real way of growing in our minds. They can take on a life of their own sometimes. Sometimes just getting those words out and those thoughts out can help just have a different kind of perspective, and maybe it doesn't take up as much space in our minds. Sometimes a support group is helpful, sometimes just going for coffee with a friend. And different people can provide different kinds of support. Some are great listeners, and some friends or support we have are just good at helping us to refocus and distract a little bit, going for coffee, going for lunch, going to the museum, just doing some other kinds of things that we can occupy our minds with rather than what's those thoughts that can consume. Educating others. Not everybody knows what this is like to live with a cancer experience, so sometimes we have to be an educator to them, to the people important to you. There's lots of people in your life that you don't need to educate, but those people that are important to you who don't get it, it might be helpful to share a little bit about what it's like so they have a better understanding. Sometimes saying things like, "This is what I'm thinking," or "These are some of the scary thoughts I'm having," can help people just have a better understanding of what life is like for you and just what that internal life is like. Especially sometimes after a cancer treatment, because oftentimes we see that frequently in our department. When people are going through treatment, they're busy and they're engaged in their treatment, they have a focus, they're doing something, they have a routine, people are asking how they're doing, and then when treatment is over, there's that expectation life gets back to normal and there's no consequences of anything that you've just been through. And we know that for a lot of people, that's when a lot of the emotions can start to arise and can start to surface, because all of a sudden there's space and there's time to sort of think about and process what's just happened. And again, people closest to us sometimes forget that. So a little bit of education maybe to say that although the treatment is over, the experience isn't. I remember at a talk once, somebody was speaking who was from the Lance Armstrong Foundation. And he said something that has stuck with me for many years, and that is, cancer can leave your body, but it doesn't leave your life. And certainly I think that's true for many, many people, that the treatment may get rid of the cancer, but it certainly doesn't get rid of the experience and how that can continue to impact people. So being honest and assertive too with what you need. Generally people, I think, many people want to help, but sometimes need some direction, and sometimes need direction from you in terms of what would be most helpful. So sometimes being honest with, it just snowed yesterday, I'd really like it. It would really help me if you shoveled the driveway, or I'm too tired to make dinner, can you bring something over? Or I really would find it helpful if you could do this. People like tasks. They feel helpful when they have a task to do. So trying to be specific with what it is that you do need. And learning to relax, that's hard. It's not easy to do. We're generally people that kind of like to be busy and like to do stuff, and learning to relax is not an easy thing to do. Sometimes we can sort of passively relax in front of the TV or on a stationary bike maybe. But learning to relax is something it's like a skill like yoga. It takes time to learn, and it takes time to sort of feel comfortable in doing that. So that practice is really important in terms of maybe just taking some slow, deep breaths, reminding yourself to breathe at different times during the day. It's impossible to feel relaxed and anxious at the same time. There's sort of two opposing experiences. You probably have never said to yourself, I feel so relaxed and anxious right now. It just doesn't fit. So if you're able to sort of enhance that relaxation and take some slow, deep breaths or engage in some activities that help you to relax, then that also just decreases that anxiety too. And we do have some stress management and relaxation classes too over at Westmount, because it is a skill and it takes some time to learn how to do that. So living this moment right now, I think sometimes that's a really challenging thing to do, because we're often thinking about the past or we're imagining the future and forgetting sometimes how to just be right now in this room on Friday, March 2nd. So when you find yourself sort of thinking about the future, and maybe you're thinking about things that are realistic or unrealistic, or maybe they're causing some fear and anxiety, it's important just to remind yourself and bring yourself back to the present. Sometimes even just looking at a clock or looking at your watch and telling yourself, okay, it's 4 o'clock on Friday, March 2nd. This is where I am. For me right now, this is the most important thing right now about my life, is just being in this room, speaking with you, trying not to think about maybe errands I need to run or what I'm going to do for dinner or all those kinds of things, just reminding myself to be right here in this room right now. So the next time you're out with friends or family, just trying to sort of just enjoy that moment and be in that moment and bring yourself back to that moment. And if you find yourself at times sort of moving ahead and going ahead of yourself, just gently bringing yourself back to right now. And rediscovering purpose or finding some kind of meaning, however big or small, is really important in terms of getting back into life and finding things that are helpful. Sometimes people discover that what was meaningful or purposeful in their life before cancer experience isn't so much the same anymore, that maybe what was really important before is less important, and maybe it's about trying to find new things that are important or new connections that are important. So whatever that is, whatever that's important, whatever gives you some sense of meaning and enjoyment and pleasure, to sort of explore that a little bit. Sometimes there's pressure, I survived this, now I need to live this big life. And it doesn't have to be a big life where you save millions of people. It can just be things that give you pleasure right now, and just those small things in life that can really add up and feel meaningful. I think I'm going to leave it at that. Yeah, so thank you.